Hello and welcome. I'm Barbara Wilson Arboleta, voice and communication coach and speech language pathologist. Be sure to like, subscribe, and share for more videos about voice, healthcare, and communication. Today, we're going to talk about medical coding in the United States. In particular, there are two types of codes that are hiding behind every interaction you have with the healthcare system. By the end of this video, you'll understand the basics of diagnosis and treatment codes and their role in your insurance and your care. Let's start with ICD codes. This refers to the International Classification of Diseases codes. These codes describe your medical conditions and are owned and managed by the World Health Organization. ICD codes started in the late 1800s and were known then as the International List of Causes of Death. And it included such common ailments at the time as smallpox, tuberculosis, and gout. Now, it's evolved, and since 1900, ICD codes now comprehensively cover all the diseases, disorders, and injuries you can think of, and some you couldn't. There have been numerous revisions of the codes, and ICD-11 is the most recent and has been available since 2022. As of this recording, however, the United States still uses the ICD-10 set because it's really complicated to update all of the computer systems involved. An ICD-10 code consists of 3 to 7 alphanumeric characters. The first 3 digits indicate the diagnosis category. The next 3 characters detail etiology, which means how did it start, anatomic site, which means where is it in your body, and severity, which means how bad is it, right? So the final character then is an extension that indicates if your visit is for the initial encounter, a subsequent encounter, or for sequelae, meaning downstream effects of something happening to you. Examples of ICD-10 codes include J38.2 for vocal fold nodules, something I see a lot as a voice-specialized speech-language pathologist. But a physical therapist might see a lot of people with S93.421A, sprain of the deltoid ligament of the right ankle, initial encounter. Now, on the other hand, W61.01 means you've been bitten by a parrot. So each ICD-10 code has specific inclusion and exclusion criteria that define it, and inaccurate coding to manipulate insurance coverage, that's fraud. Okay, so I want to talk about, though, how the insurances do sometimes try to manipulate these codes. So I was put in a terrible situation when I was in private practice. There was this particular insurance company that repeatedly told the parents of my pediatric patients that their service wasn't covered because I, quote, didn't bill the right code. The insurance company told these families that the service would be covered if I billed a different ICD code on my bill. The problem is, I didn't bill the wrong code. I billed for a childhood speech disorder, as I am legally obligated to do. Changing the code to a neurologic speech disorder code, for example, would have been illegal. So if I had complied with this request, I would have even jeopardized my license to practice speech pathology. Now, because this insurance company lied to these families, then the families blamed me and they argued with me about it. So please, please be skeptical if your insurance tries to get out of paying by saying your provider used the wrong diagnosis code, because usually what they're really saying is that they won't pay for the diagnosis you have, that they don't consider it medically necessary. Now, I do have a whole video about medical necessity in the US healthcare system, which I welcome you to watch. Let's discuss CPT codes, or Current Procedural Terminology Codes. This code set is owned by the American Medical Association. And there are different categories of CPT codes, but for our purposes, I want to focus on Category 1 codes today. These 5-digit codes, introduced in 1966 and adopted by Medicare and Medicaid in 1983, represent the procedures performed by your healthcare provider. They are all of the things your provider might do to give you care. For example, 92507 is individual speech therapy, as like a speech therapy visit, right? And 93000 is a routine electrocardiogram with at least 12 leads. So CPT codes are categorized into 6 different sections, and sometimes their placement can be confusing, like the fact that laryngeal examination with a flexible laryngoscope, which is a camera that looks like a piece of spaghetti that's threaded through your nose to see your throat. And when that is done with a strobe light, which is what we need to see how the vocal folds are vibrating, that code is put into the surgery section. Now, this means that a lot of people are paying super high co-payments for a diagnostic exam of their throat. And it's not a surgical procedure, but that's where it is. And the insurance companies take advantage of that by saying, well, it's in the surgical section, so we're going to make you pay a surgical copayment for that. And really, it's not surgery. It's not. But this is the world of health insurance in the United States. So CPT codes may differ also in terms of whether or not they're timed. So many codes used by physical therapists, for example, are timed codes billed in 15-minute increments called units. So for a single visit, several CPT codes may be billed, and some codes may be billed for more than one unit. Conversely, speech-language pathology codes include a large number of untimed codes. This means that only one unit of the code can be billed per day, and the visit may be longer at some times than others. Now, another feature of some CPT codes is the concept of complexity. So examples of these are the E and M codes, the evaluation and management codes used by doctors. These codes form the core of an office visit with a doctor, but the code selected is going to change based on a number of parameters that define the complexity of the visit. Understanding ICD and CPT codes is vital when discussing coverage with your insurance. Knowing the specific codes for your condition and treatment allows you to ask more intelligent questions about your coverage. Now, your insurance company may still decline to tell you for sure if that care will be covered. And, I'll refer you again back to my video about medical necessity about that. But at least you have an idea of what you might be covered for if you know what those codes are. Know this, though. Yes. It is highly unlikely that the front desk staff member at your doctor's office is going to know the codes. So don't get angry at them when they don't have it, right? Your healthcare provider should be able to tell you the codes, but you do often need to have your evaluation visit before they know what your final diagnosis code is going to be, or what treatment codes they're going to need to do to take care of that condition. So often for this first visit, it is very hard for people to be able to say, well, these are the codes we're going to use, because they don't know just on your description really what's going on yet, right? So this introduction to medical coding may lead you to believe that choosing correct codes is really straightforward. There's actually a lot of nuance under the surface, though, and so you should know that every doctor's office, clinic, and hospital in the United States has a group of trained medical coders to help them bill correctly. I mean, unless they're like a super, super small office or something, right? So it's like the varied parameters such as timed or untimed status or E&M complexity levels makes predicting the final code set tricky, and this complicates efforts to be transparent in terms of the cost of care. I mean, I hope this has been a helpful introduction to medical coding. I think understanding these codes is a really powerful tool in helping to manage your own healthcare and to get more information about what's going on for you and your care, right? Don't forget to like, subscribe, and share. Thank you so much for watching. Until next time, stay informed and stay healthy.